I'm going to start by telling you a bit about the work in the Service Transformation Group that I chair. As you know, this whole programme that we're all involved in together is around transforming services. There's been lots of focus on the therapy training, and those of us that are in IAPT teams are very aware of our colleagues going off and getting trained, and our supervisors and our managers. But actually, that's just a part of it, isn't it? The main bit is how we transform our whole service to look radically different and work in a much better way for young people and for ourselves. Now, the Service Development Task and Finish Group is one of 4 groups. There's an Outcomes and Evaluation group that Miranda chairs. There's one that's designed the curriculum. There was a short-term one around accreditation, and there's a Service Development group. And the people on the Service Development group are a range of people from different backgrounds. They've all had experience in either leading or being involved in some way in service transformation in their own teams or nationally or sometimes internationally. And I know there's quite a few people from the Service Development Group here today, so I thought it'd be really nice if you could just stand up and identify yourselves so people can see who we are. I saw Lee back. Yes, he's so reluctant. Yes. Anyone else? Okay, that's a few of us. There's a load more that weren't able to be here today, but many of us you will know. So what do we do? Well, a big part of what we do is be there to give some advice and support to the other groups around how what they're doing might be influenced by service transformation or vice versa. We've also been really involved in shortlisting and interviewing for the new collaboratives. And we're also there to help services think about how to have service user participation and involve young people and families in what they're doing. Because of the varied experiences we've got in the group, and we all have a lot of contacts, we're well placed to problem solve. So if somebody in a partnership or a collaborative is struggling with something to do with service transformation, they could come to us and ask us if we knew anyone or had got any ideas, and if we didn't have any ideas ourselves, we'd know a man who could, I'm sure. And the big bit of what we've done just in the last couple of months, and this is what I'm going to focus on talking about this afternoon, is work on what does a good transformed IAPT service look like? What do we mean by that? And then how do we measure that people have transformed and make sure that measurement is accurate and robust? And we've done that by working with the other groups to develop key performance indicators that are collected through the data set that you're all entering data into. And then we've worked closely with the accreditation group that Peter Fonagy has chaired around thinking about how would you accredit services as regards the service transformational aspect. So I'm going to tell you about those 2 bits of work, which are still work in progress. Nothing's completely set in stone yet. The first thing we struggled with is what does a transformed service look like? I think we've all got our different views about what good looks like, so I'll tell you about how we've approached that. And then how do we measure that through metrics? So this is what we've done. We've set great store by listening to what young people tell us is a transformed service. What does good look like to them? And somebody mentioned this morning the report that was done last year by Young Minds with young people about what a good CAM service is. And there's a whole list of things that are very important to them. It's a really good read if anyone wants to read it. It's on the website, isn't it? The IAPT website. And I'll tell you a bit about what some of those things are in a moment. We then thought between us about what do we think our values were based on our experiences. I forgot to say that on the group we've got representatives of the collaboratives as well, so your views are sort of fed in through that. And we felt that we wanted services to be effective, have time for reflective practice, collaborative practice with people, and timely sort of streamlined services. We also looked at existing quality standards for CAMS teams, of which the biggest framework is that run by the Quality Network for Community CAMS, and for services that choose to run the choice and partnership approach, there's some standards around that. So we looked at those things and mapped them onto what we were trying to do. And we decided we were going to link accreditation to the things that we were already collecting through the KPIs to minimise burden on services. Because we know everybody's collecting all this data, entering it all, and this change is a massive undertaking for all of us. So we wanted to make it easy for people to do, not another additional burden. So young people, this is the sort of things you'll be familiar with that they've told us all makes the service good for them. So they want to be able to access mental health services from multiple sources so that it's easy, quick, that they can self-refer. We've heard that lots today. They've said that. They want to be seen quickly, not when their problems have got really entrenched. And they want to know what the choices are open to them, whether that's in the mental health service, in some other service, within the mental health services, what choices of interventions and help could they get. They want decision-making to be collaborative with them and shared with them so that they can truly consent and make decisions about what happens. They want to have goals. They want us to review their goals with them. They want us to involve people as appropriate, you know, family, friends, teachers, etc. Transitions. Somebody mentioned this morning how bad we are at managing transitions. That's something that they really want us to do better, whether that's transitions to an adult service, to another service, or just out of the service. And they want to be truly involved in designing the service, reviewing the service, every single aspect. So, in other words, what they're saying is they want true participation in absolutely everything that happens to them, from their own sort of clinical work right the way through recruitment, service design, everything. So in the group, we've been thinking about how can we incorporate those values that young people have into supporting services to redesign so that they can provide those types of services, and then how do we measure that people are doing it? And as I said before, we want to make it easy and quick for you out there transforming your services to know that you're on track. So we decided that for accreditation, when that comes in, that for the service transformation part of children's IAPT would be linked to the key performance indicators being met. But because we want to help people with a culture of continuous improvement in their services and being curious about what they do, what they provide, is it working, and revising what they do the whole time, that culture of self-review, we thought that supporting services to self-review to a wider set of children's IAPT standards and supporting that through giving some best practice guidance and helping that happen through working with commissioners and young people locally would be the best way forward. That's not set in stone, that's just a proposal at the moment. So we've come up with 25 standards, which sounds a lot. We've grouped them under these areas, one around the mix of skills you have in teams and how you have mapped that and used them well. A whole set of standards around mapping flow through the service, using flow management techniques, knowing what the capacity in your service is, things around that. Items around leadership, because we all know that you can't make any change sustainable unless you've got good leadership in teams. And then participation and collaboration with young people, and we've divided that into two bits, at the service level and at the more clinical level. And I'm not going to go in detail about every single one of those because, as I said before, it's not set in stone, but we will be gathering your views about what you think about some of these things. So just thinking about the accreditation for service transformation, this is what we're proposing, is that they will be linked to the key performance indicators that are being pulled off the data you're all submitting. So for the skill mix area, this will be things like the number of therapists in training. I feel I can't say the word therapist now after what the young people say. The number of people trying to help in training. The numbers of young people who are having help from the service. For the demand and capacity bit, whether you are reaching your locally defined waiting times. Do you have self-referral? Whatever that means in your local area, because we know that varies across the piece. For the participation aspects, it's the KPIs around, have you set goals with people? Have you reviewed goals with young people? Do you routinely collect feedback from young people about the service and involve them in appraisals, etc.? And is session-by-session monitoring in place? So these are things that your services you are already entering data into the data set about this, and it's already being collected centrally through your KPIs. So the attainment in these areas will be what will be part of accreditation for the service development aspect of what you're doing. And we're proposing a sort of developmental approach because we know that it's a tall order what we're all being asked to do. So most people will be not very high in the percentage attainment of any of those things initially, but what we hope to support people with over the years is that we'll get better and better. And this is just what we're proposing. And eventually what we want is for people to be at the over 90% mark in all those areas to be accredited. For the self-review, what we're proposing is that teams and services with their young people and parents, users, and their commissioners and partner agencies review the service regularly together, have an action plan and change things, and then review it again and have this repeating cycle. And we want it to be something that's embedded in what people just naturally do in their service, rather than it being something that's imposed on them from outside, an external person coming to review you. We all have that, don't we, when we have our Ofsted inspections or if we have QNCC. We didn't want to replicate that. We want this to be something that's owned between us and our partners and our young people around owning the service together and transforming together and continuous improvements. So what we're hoping to do to support everybody in this is write some best practice guidance of things that have been shown to work in other services and replicated, shown to add value in service transformation, that people can then use to help them on their way. And we're sort of making a presumption that if you are doing these other standards, so the other 18, 19 wider standards, you are more likely to meet that 90% mark on the KPIs that I showed you earlier. So these broader standards, these 18 broader standards, are things that young people want, about being involved, about the shared decision-making, choices and assessments that I spoke to you about earlier, but also items around leadership, skills mapping, demand and capacity management, flow management. So at some point, in the near future, because we're hoping to write some guidance by the end of the year, aren't we, Barry, who's leading on it? We will be asking you all for some examples of things that you've done that have worked, or that they may be things that you've tried through Children's IAPT, but they may be things that you've done in your service that were transformational in the past before you were even an IAPT team. We will come to you for examples to put into this guidance for other people to use. And eventually, we hope all this to link to the e-portal, which you haven't heard much about today, but Raf, I think, will talk a bit about that this afternoon, later on after tea. The e-portal will be a resource for all of us where we can access a whole range of information. So, that was very briefly some of the work around accreditation and service transformation standards work that we've been doing. It's work in progress, it's not fixed in stone, so don't panic if you think it sounds awful, just please let us know.